The Narcotics Control Commission, NACOC, has carried out a series of intelligence-led operations across the eastern and Greater Accra regions, dismantling several drug dens as part of a festive season crackdown dubbed Operation White Ember. NACOC, in a statement, says the coordinated raids targeted known drug hotspots stretching from Manfi and Tutu in the eastern region to Medina, Redco Flats, Zongo Junction, and the railway slums around Airport City here in Accra. And now for more on this, the head of public relations at the Narcotics Control Commission, Francis Amoah, joins us on the telephone. Good evening to you, Mr. Amoah. Merry Christmas to you, and thank you for joining us here on the ChannelOne newsroom. First of all, tell us about this operation and why you chose to do it this festive season.
Yeah, thank you. And let me also wish our viewers a Merry Christmas, and officers of Narcotics Control Commission also, we wish them a Merry Christmas. I think that last week we issued a statement and we made it clear that this festive period we are going to go all out on some of the intelligence we've gathered to make sure that people will go about their Christmas free of any drug activity, and also to let people know that the Narcotics Control Commission is still active, is still vibrant, and is still working to make sure that we achieve our mandate, which is for public health and safety. So basically, we did the operation to make sure that people who are doing that drug, who are selling, who are distributing, and who are engaged in usage, to make them know that it is against the law and therefore they can't continue to do that. And also we wanted citizenry that we work for to know that, yes, the Narcotics Control Commission is there, and the Narcotics Control Commission would always work on any intelligence that we gather. Once we receive the information and we treat it and it becomes actionable intelligence, then obviously we will work with it.
Okay, sir. What did you find during this exercise, and how widespread is this drug abuse phenomenon?
Yes, well, we arrested different types of narcotics. We arrested cannabis. We arrested alcohol laced with cannabis. We also arrested methamphetamine and ecstasy and other drugs. One can say that depending on which area that you go to, the usage of drugs is out there, that the young people, especially the youths, are on it. And we decided to do it because of Christmas. A lot of activities, a lot of activities are planned. People carry out a lot of engagement. And we know from research that during these engagements, during this party, and during these activities, a lot more people are tempted to use these narcotic drugs. And that is why we decided that we would do it. And let me assure the general public that it is not going to be a one-off thing. When I engaged you last week, I said that we had engaged in a series of raids, but it is something that is going to be continuous because our Deputy Director General in charge of enforcement and control is somebody who is eager and always would want action, and therefore it is something that it is going to be continuous. We're going to do it to make sure that our society, our communities know that the Narcotics Control Commission is there and is there for them.
All right, Mr. Amoah, these drugs, where are these people getting these drugs from? Are they manufactured locally or they are imported?
Majority of them are imported because locally the only drug that you can get is cannabis. Cannabis is something that you get it locally because anywhere in our country, if you plant cannabis, it grows well, and therefore cannabis is something that it is grown locally. even though we're receiving or we're getting different brands or different types coming in from other parts of the world into our country. But majority of these drugs talk about cocaine, talk about heroin and ecstasies and all these methamphetamine, ephedrine. They are all drugs that are imported. When you look at cocaine, it is something that is a plant that is cultivated and produced in Southern American countries. When you look at heroin, it's Eastern Asia, that is where it is produced, and it comes into our country. Methamphetamine, it's something that you put a lot of chemicals together and you get that. And that is also, most often than not, it comes from Nigeria and South Africa. So all these drugs are drugs that are imported into our country. But the good thing about it is that once we are alert, once we work with the general public, once it comes in, it will be arrested and the perpetrators are dealt with according to law.
Mr. Amoah, you mentioned that most of them are imported. Why are they so able to just come into the country so easily? And why are we not able to stop them from coming in? Because you can find some of these drugs very easily around the country.
Yes, I think the issue of the importation of drugs is that there are different outlets. People can decide to use our coastline, which is very wide, which is porous, and people can also decide to use our airports, our seaports, Tema, Takoradi, Kotoka International Airport, and sometimes the land borders. But like I said earlier, people who are bringing it in through Kotoka International Airport is a no-go area because once you use it, it will be arrested. We can look at the coastal line. That is widespread. That is porous. But one of the things that we have indicated and we've said is that the new administration at the Narcotics Control Commission, as part of strategy, what we are doing is that we're trying to divide the coastline so that it can be manned properly. So if you say that maybe from Ningo Pram Pram to Teshi, you divide it so that you have people who are manning it. And this thing that I'm saying is not something that the Narcotics Control Commission alone is going to do. We're going to work closely. We're going to partner police, marine, and we're also going to work with the Navy to make sure that even though we may not be able to patrol all our coastline, but majority of it will be properly patrolled with the requisite equipment and tools that we will need to make sure that people do not drop their goods, as they call it, so that local canoes can go and cut it and do the distribution. So it is something that our Director General is keen about it. We're working towards it to make sure that our coastlines are properly manned, not only with the Narcotics Control Commission, but also in collaboration with the Ghana Navy and also the police, marine.
Okay. The individuals behind, why are we not going after them? Or is it the case we don't have the capacity to do so?
We do go after them. We do go after them. Like I mentioned somewhere last week, currently we have about 50 cases that are pending, different levels, different courts that are we are after. We are hoping that 2026 we will the courts will expedite action on some of these things so that the perpetrators will be brought to book. It is not that Narcotics Control Commission is not going after. And one of the things that we should also understand is that the work of the Narcotics Control Commission is intelligence-based.
Okay. Our
operations are intelligence-led. Once we get the intelligence, once we get the information, and we process it and we know that Kwadwo Mensah Akosia is behind this, we will definitely go after them. And one of the things that our new bosses are saying, and they stick to it, is that once you're arrested with any drug-related offenses in the country, it's only the law courts or God that can save you from the clutches of the Narcotics Control Commission.
Okay, finally, sir, before you go, what happens to these individuals who have just been arrested?
Yeah, what we do is that we do screening. We're going on with screening. We do a lot of screening of all the people that were arrested. And once we do the screening and there are people who would have to let go, caution them and let them go, we will do that. And those who would have to face prosecution would also definitely do that. And one of the things that, let me assure Ghanaians, is that we said it. We told the whole citizenry that during Christmas, this is what we are going to do. It's not going to be a one-off thing. It is something that it will be continuous. And we've done it. And it's something that we will continue to do it. Whatever we say we are going to do, with the help of God and with our professional guys, with our trained guys, and with the support and leadership of our current management, I am very, very sure that we'll see to the end of everything that we say that we're going to do. And one thing that we would also request or we will require from the people is that national security some time ago, there was a slogan, if you see something, say something. Once you know that in your locality there is some of these activities going on, don't keep quiet. Say something, and once you say it, we will put intelligence into it, we will investigate, and if we have to strike, we will make sure that we strike. All these things that we're doing to make sure that our citizenry live in safety and they can go about their job without any fear of any person.
All right, I'm grateful to you, Mr. Francis Amoah. He is the head of public relations at the Narcotics Control Commission.